This is Group Two's wiki. We did our wiki on lateral violence. It is important to understand lateral violence as a nurse because when working in the medical field, lateral violence is always occurring in the workplace. My name is Logan Ballard, and my part of the wiki was to explain what lateral violence is. Lateral violence is hostile and aggressive behavior by individual or group members towards another member or nurse of the larger group. The issue of lateral violence or bullying is widespread in nursing and can have devastating long-term effects on the recipients. The best way to deal with lateral violence is with kindness. Examples of lateral violence include being yelled at or screamed at in front of other individuals by a nurse or colleague, being accused of errors being made by someone else, being the subject of gossiping, being the topic of rumors, being humiliated in front of others, being sabotaged, having thoughts or feelings ignored, and much more. Low self-esteem and self-worth is often the top reason why others may practice lateral violence towards other nurses. Check out the What is Lateral Violence tab on our page to learn more. The struggle with this project was the initial start of trying to figure out the wiki and how to use it, and also coming up with a topic. There were so many to choose from that it was hard for our group to narrow down to one specific topic. The rewards of this project is the insight that we learned about with lateral violence and how to deal with the issue when one day working as a nurse.
Hi, my name is Bonnie Barty, and for my part of the Group 2 Wiki, I researched the different interventions used to stop lateral violence in nursing. Education is the most important method for tackling lateral violence. Nurses need to be aware of what constitutes lateral violence, recognize the negative impacts of lateral violence, take personal accountability for their own behavior, and learn to call others out who behave inappropriately. Organizational commitment to a zero tolerance policy is essential. Zero tolerance policy should include clear and concise behavioral expectations and consequences for employees who exhibit unprofessional behavior. Decreasing lateral violence needs to be a priority for nurse managers. Nurse managers need to deal with lateral violence promptly, not dismiss inappropriate behavior, and be consistent. Consequences for negative behavior should follow written policy. The biggest challenge I faced while completing this project involved my limited experience creating a wiki. I had trouble copying and pasting my list of interventions I created in a Word document to my wiki page. For some reason, it wanted to cut off the left-hand side of the document or just post a link to the Word document and not put the text on my actual wiki page. Fortunately, I was able to reach out to my group members and Dr. Hickey for help. The rewards for completing this project included learning more about lateral violence, getting to know several of my classmates, and practicing teamwork to accomplish a task.
Hi, I'm Michelle Baker, and I research the negative impact of lateral violence on nurses. Lateral violence can create a wide variety of problems, not only for the victim of lateral violence, but for other nurses on the floor or on a unit in a healthcare facility. The victim of lateral violence can experience large amounts of stress, as well as physical health problems directly related to the lateral violence. Other nurses on the floor or unit may also be under stress from working in a hostile environment or picking up any extra work left behind by the victim who may not be able to complete tasks or may even be absent from work due to an inability to deal with the lateral violence. The positives from this project was working with my group, getting to know them. We had a really good working relationship. I feel like that worked out really well. The negatives was my inexperience in working with wikis. I did not come into this project with a lot of knowledge of wikis, but I feel like I have been able to work through that and feel like I've gained a greater amount of knowledge should I need to create one again in the future.
Hi, my name is Aaron Beaver, and I was responsible for finding the codes and laws that exist to try to prevent lateral violence. An example of a code that a hospital put out would be a document sent either by email or by handout. Every employee would receive a copy of it, and it would explain some examples of lateral violence. It would also have a list of punishments that would happen if anyone was caught committing lateral violence upon another coworker. The employees would all have to sign and date this document and return it the same way it was sent to them. A law would be a piece of legislation that is either put out by the federal government or by the individual state governments. The legislation would be informing the hospital management that they need to come up with codes and programs for offenders of lateral violence and the victims. They would also need to strengthen or increase penalties for acts of lateral violence that occur in the hospitals. I also did the interview for our wiki. I interviewed my grandmother about her experience with nurses. It was a very insightful conversation, and I highly encourage you to go watch it. It was a story that nobody in my family has heard before. It was nice to hear her opinion of nurses.
Hi, my name is Rachel Avery, and my part of the wiki was to find videos that gave examples and first-hand scenarios on lateral violence in nursing. The first video shows two nurses exhibiting lateral violence during a shift change. The day shift nurse knocks down the night shift nurse by undermining her job title. The second video I selected gives a definition of lateral violence. It shows scenarios of lateral violence such as verbal affront, backstabbing, undermining activities, sabotage, infighting, and many more. It finishes with expected behaviors of nurses in the workplace and tips to avoid lateral violence. The object of the third video is to address what lateral violence is. This particular video gives 3 scenarios of types of different lateral violence seen among nurses. After each scenario, there's a slide that explains how lateral violence took place and what the major issues were. The last and final video shows 2 scenes. The first scene showing the lateral violence taking place between the veteran and the new RN. This video also shows the patient's reaction and how lateral violence can affect them as well. The second scene in the video shows how the issues should have been handled in a calm and collected way without lateral violence. A challenge I faced while making this wiki was the initial start and finding a starting point for my page. Although I had a difficult time starting my wiki page, once I started, I had no issues. The rewards of working on this wiki was meeting with my group members and getting to know a little bit more about them. Also learning more about lateral violence and how to prevent it from affecting us when we become nurses.